Hello, friends. Is your child barking like a seal, coughing in a way that's not that normal cough? It sounds a little bit off. That could be croup. So let's jump into this and try to figure out exactly what's going on and what you can do to help that little one right away. All right. So, as a reminder, this is not medical advice. This is just educational and entertainment content. So, what is croup? Croup is technically called laryngeotracheobronchitis. That's a lot of words. What that means is that it's an infection basically of the voice box. That's why the little kid's voice changes and also why they sound that way when they cough. It's very common in childhood. So probably you have seen it before in other children of yours, if you have more than one child, or your children's friends, caused by a virus called parainfluenza virus. It's going to cause inflammation of the trachea, the larynx, and the bronchi. The trachea is the breathing tube. The larynx is the part that has the voice box, and the bronchi are a little bit farther down, closer to the lungs. So it's not an infection of the lungs per se. That's why it's not a pneumonia per se. What we'll see is that it causes a number of complex symptoms, and it can be life-threatening. So you should take this really seriously. This is not like a normal common cold. There is a risk to life and death here. So as I mentioned, you'll observe the barking cough. It sounds like a baby seal. It's really cute at first, but it can be serious. There's hoarseness, there's stridor, which we'll talk about more. And it typically happens on inspiration. So when the child breathes in, that's when you're going to first hear the stridor. And the stridor is a very particular kind of sound. And here's a schematic for the Mayo Clinic. Here's the larynx, which is the voice box, the trachea down here where the breathing tube is. Behind the breathing tube is the esophagus where food goes, and the infection is going to be higher up here rather than lower down into the lungs. So as the symptoms start, days 1 and 2 are going to look like, could this be a cold? What's going on? Runny nose, nasal congestion, mild fever, mild cough. And then as things get a little more acute, typically day 2, day 3, that's where you're going to start noticing the seal-like sound, the barking cough, especially if the child starts crying or starts getting into a coughing pattern. That's when the barking cough will be heard. And sometimes you can just hear it across the room and you're like, what the heck is that? Somebody let in a seal into our house? What's going on? Oftentimes, doctors will diagnose this in the waiting room. They'll walk into the waiting room, bunch of kids running around, and they already know it's croup from hearing the kid bark. Here, it gets dangerous when the child has increased breathing effort and they're trying to breathe because, as you saw in that diagram, that area of the respiratory system is very narrow and it can be closed off with stridor as they inspire. If things go well, it remains mild. There's going to be a recovery phase by days 4 to 7, and these symptoms are going to decrease. The hoarseness and the mild cough are going to linger, sometimes even for a week or two, but typically within 7 to 10 days, things should be back to baseline or close to it. In terms of severity, and this is what's really important, you need to be able to differentiate mild symptoms from moderate to severe because you need to know when to ask for an appointment with the doctor, when to go to the emergency room, when you're going to need medication, and hopefully never, but when something even more severe like preventing impending respiratory collapse and death using something like intubation. So mild symptoms is no stridor at rest. The kid is just running around doing their thing, occasionally coughing, but when they breathe, they're going to have maybe some stridor when they have a coughing spell. Moderate symptoms are when stridor starts to be at rest. So the kid is not necessarily worked up, but they're noticing as they breathe in, they're going to have that high-pitched sound start. It doesn't have to be every breath to be at rest. It could just be not when they're worked up. And that is what is the art of medicine. You need to distinguish between those two to determine when the medication is really needed. They might even be anxious because remember, the child is trying to get oxygen into their lungs so that it can go to their brain and their body. And when they're not able to do that, they're going to start getting a little bit anxious. They may have difficulty drinking fluids, maybe refusing fluids. And then if you take their shirt off, you can look at the retractions of the chest. Retractions mean if you look at the ribs, you're going to see skin being pulled in between those rib bones below the ribs. That's a sign that they're really sucking in air really hard and they're trying their best to get as much oxygen as possible. That's the first sign after the stridor at rest of something getting worse. So that's when you want to really consider going to the emergency room, calling your pediatrician or doctor. The other thing is nasal flaring. That's when the nostrils start opening up, the side starts flaring up because they're trying to suck in air really intensely like that. And you're going to notice that even if it's not that dramatic, you're going to see some of the flaring of the nostrils. Their breathing rate's going to be higher. Why? Because if you breathe faster, you're going to get more oxygen into your body. That's a sign of some distress or some low oxygen. You may have an oxygen monitor you can put on their finger at home too. That's another way to check how things are going. Unfortunately, things can get severe pretty fast if you don't pay attention. So severe means persistent stridor at rest. Cyanosis, meaning they're maybe changing the color of their skin. They're getting blue around their lips. They're getting really tired. They're getting exhausted from breathing really intensely. The sounds are going to be loud at rest, and you're going to hear the high-pitched sound. It's going to be squeaky, more common. And you really need to call the ambulance right away, get them to the hospital. And when they get agitated, it's going to get worse. Children do die of this. So when it happens, their breath sounds will diminish and sometimes even disappear. So this is a serious condition. It's not a normal cold. It starts off as a normal cold and it looks like it's nothing, but then it can get dangerous pretty fast. So the first thing to remember is don't confuse croup with what's called epiglottitis. Epiglottitis is an infection or inflammation of the epiglottis, and that is a part of the throat that I'm going to talk about. So epiglottitis is even more sudden and severe. There's going to be no or minimal cough, and there's going to be more drooling and difficulty swallowing in epiglottitis, as opposed to this slow progression of starting off with cough, fever, runny nose in croup. There's going to be more hoarseness and a muffled voice because what's happening is the epiglottis in the back of the throat is basically swelling up and causing this difficulty with breathing. The fever is going to be more closer to 102, 103. It's going to be higher. It's going to be faster in onset. And what you'll notice is the kid is going to want to sit upright. They lie down flat. They're going to want to get up. They're going to not sit flat for a long time. They're going to lean forward. They're going to be drooling. It's called tripod position. That is a sign that they're naturally trying to get more air into their body by leaning forward, because when they lean down flat, the glottis kind of blocks their airway. When you give them humidified or cooled air, as you do in croup, which helps croup, it doesn't really help with epiglottitis. And this is caused by a totally different organism, Haemophilus influenza. But yeah, this is an emergency. So you need to be able to quickly distinguish between croup and epiglottitis, first of all, and you want to distinguish between mild croup and moderate to severe croup. Those are the two branching chains in your mind for super mom, super dad. You want to think, okay, I hear cough. Is it mild or is this moderate to severe? And is this croup or is this epiglottitis? If it's moderate to severe, you want to get medical attention. If it's epiglottitis, you want to call the ambulance. And here is a picture of epiglottitis to make things even more clear. So this is the mouth, and the epiglottis is this area here that's between the lungs and the mouth. It's a little tissue that helps do a bunch of things, but basically here you can see it's swollen and it's gotten much bigger in size, and that is blocking the airway. See, the airway here is now a lot smaller in terms of what air can go in. So that's going to be different than, okay, so let's get back to croup. So for home care, for mild symptom, of course, sleeping is good because when you sleep, your immune system will be stronger, and that's going to fight off this infection faster. Now, here's one thing. If you're trying to prevent those episodes of stridor whenever the baby or the child is coughing or getting upset, kids cry. But to the extent that they can cry less, they're going to have less strain on their airway and on their vocal cords, and they're going to have less cycles of cough and respiratory distress. So what I sometimes tell patients is, hey, take it easy and give in to some of those demands you normally say no to, just to decrease the number of crying episodes per day. If it's normally only 10 crying episodes per day, and you can get it down to 3 or 4 by, I don't know, saying yes to some ice cream or letting the kid watch some cartoons, those 7 crying episodes that you avoided are going to produce less stridor for the kid, maybe keep things in the mild range and prevent them from going to severe or moderate. It's not true that by being a little more permissive, you're going to prevent severe croup, but you can prevent the symptoms from flaring up. So that's something to consider. Hydration is really important because as you're fighting an infection, you need adequate hydration to get all those immune molecules and cells to the right place they're trying to go to. And also because when people are sick, dehydration is a big problem. You can use Pedialyte to keep the airway moist as well, because a moist airway is better than a dry airway. Cold outdoor air has been actually studied empirically for croup and has been shown to actually help the croup symptoms. Sometimes when people are running to the emergency room, because croup is worse at night than it is during the daytime. So during the daytime, the kid will seem to improve. Oh, things are great. He's playing, doing his thing. And then at night, 2 in the morning, 3 in the morning, the parents will have trouble. They'll run to the emergency room. Sometimes in the middle of getting to the emergency room, the cold air from outside will decrease the symptoms. They get to the emergency room and the kid is doing much better. So cold air exposure is an option to improve symptoms. One can also try humidified air. So if you have a humidifier in your home and you try to get some of that into the room, that can help decrease the intensity, especially if it's a cool mist humidifier. Another option is a steamy bathroom. Putting on the shower to hot and just sitting in there with your child, letting that air loosen things up. Avoiding dehydration, as I mentioned, is an important thing. So you want to avoid saunas and jacuzzis. So sometimes we hear, oh, my kid has croup. Can we take them to the sauna because cold is bad for them and hot is good for them? No, because the sauna is going to actually increase their temperature and it's going to cause more dehydration. And the dehydration is going to worsen their infection. Same thing for a jacuzzi. You should never really have a child in a jacuzzi to begin with under age 5 or 6 because their bodies can't regulate. So we want to keep the temperature of the water that children are in around high 80s, 87, 89 to 90 max. But yeah, so these are some ways that dehydration gets worse when parents are trying to help, but they do their best. Tylenol and Motrin for fever. Remember, a mild fever is actually helping fight the infection, but if it gets too high, which could be 102, 101, then you want to consider giving some Tylenol or Motrin, but not Motrin for very young kids. So talk to your pediatrician about what is appropriate, and that can help with comfort so they can actually sleep. All right, so now when should you go to the emergency room? As I mentioned with croup, anytime you have more than mild symptoms, you want to go to the call your doctor or go to the emergency room when the key symptom you're looking for here is stridor at rest. Remember that. If you take nothing else from this, stridor at rest is the thing to think about. If they have difficulty holding down fluids, they can get dehydrated. That can be very dangerous and even deadly. Severe respiratory distress, like when they really are showing you, I'm having a hard time breathing. The retractions are there, the nasal flaring is there, they're cyanotic and they have blue lips, you gotta call the ambulance. If these symptoms don't get better over 7 days, they keep getting worse or just not getting better, that's another reason. Now, what's going to happen with medical treatment for, first of all, oxygen therapy is going to be needed if their saturation goes below 92%. So you can have the oxygen monitor on the finger at home to check that as well. But the mainstay of treatment is corticosteroids. And you might say, what are you doing? You're giving my child steroids? They don't want to weightlift. They're not trying to get buff. No, it's not that kind of steroid. It's called dexamethasone. And what that's going to do is that's going to decrease the inflammation in the throat. It's going to allow the airway to open up. The onset of action for this is going to be a couple of hours or 1 hour to 2 hours. So it's not like an immediate effect, but a single dose of dexamethasone is going to last about 48 hours. Sometimes people need more than one dose, but typically one dose will get them through the acute period. But sometimes when symptoms are not getting better, people will give children epinephrine, which is a sympathetic nervous system hormone that is targeted to the respiratory system because it's given through this nebulizer, like this mask. And that nebulized epinephrine can be more immediate. It doesn't act as slowly as the corticosteroids. So you'll see immediate responses to respiratory distress with epinephrine. So sometimes that's given in the emergency room or in the hospital. Your dexamethasone can be given to in urgent care or by your pediatrician in the outpatient setting. So sometimes you can prevent going to the hospital by starting off with a dose of dexamethasone. In rare cases, unfortunately, some kids will require intubation or even ventilation to prevent death from respiratory failure. That's very, very rare, but it does happen. So it's really important to know this and get to the hospital as needed. So I really hope this has helped you. Hopefully keeps your children healthy and safe. If you like this, check out this other video and feel free to join my free newsletter. Take care.